Doped sample, there are some rod-like structure are grown on the surfaces, and the roughness of these film found to be 51, 1536 for undoped and doped Jadeno sample. We also recorded the optical transmission. The undoped and doped film showing the highly transparent. These films are highly transparent in the visible and NIR near visible in near infrared region. The film are highly 80%, 80 to 92%. It lies between 80 to 92%. We also measure the thickness of these sample, and the thickness found to be 140, 115, 100, and 160 nanometer for undoped and doped sample respectively. We also calculated the band gap by the tau plot. Here we plotted the graph between h nu and alpha h nu square. The band gap is found to be 3.15, 3.32, 3.38, and 3.4 electron volt for undoped and doped sample respectively. Thus, we found that the total enhancement in the band gap is about 8.25% with undoped and 10 atomic percent, 15 atomic percent Mg doped obtained. That is the total tuning of the band gap is found 8.25%. For the photoluminescence spectra, we recorded the PLE spectrum. PLE spectrum is the photoluminescence excitation spectrum, which is required to get the excitation wavelength. Here, PLE spectrum shows that there are possibilities of three peaks at 256, 266, and 325 nanometer. Since the peak of the 325 nanometer is stronger, so we use that excitation peak at. So we use 325 nanometer as an excitation wavelength. PL spectra of undoped and doped sample shows the strong NV emission at 399 nanometer. If we resolve this spectrum, then found that it is also a huge peak, and along with some defect related emission at 4489, 448 nanometer and 485 nanometer. The peak of the NV emission shifted to 395, 344, and 383 nanometer for doped sample 5, 10, and 15 atomic percent respectively. Here we seen that this red color spectra is showing high intensity along as compared to other spectrum. That is the 5% atomic dope, 5% Mg dope sample, which is showing the 14 times higher as compared to undoped sample. The intensity of the NV emission is found to be 14 times more than the undoped sample. The ratio of intensities of NV to defect emission, NV emission to defect emission are 1.746, 2.4, and 3.125, which shows that there is a six-fold emission in the six-fold NV emission is found in the 5 atomic percent Mg dope sample. We also recorded the photoresponse. Photoresponse means we uses the setup which consists of one UV lamp and some multimeter and other electronics devices to record the current. Here we uses the spectrum shows that here we fix at 5 voltage and fix the 5-minute off and 15-minute on and 15-minute off pattern. When we off the light, there is no current is no light is fall on the sample. That was we have shut down the light source and there are dark in the chamber, and then we put the sample 5 minutes and recorded the current, which was found to be about straight. And then as we on the current, as we on the lamp, we shut on the shutter, then the current rises sharply and become stable. We close the shutter of the chamber, then light falls down. This shows that UV off, UV on, and UV light off, on, off pattern. So we have recorded this photo response for the all 4 samples, which found that the rise time is found to be 3.99 seconds, 71 seconds, 26 seconds, 125 seconds for undoped 5, 10, and 15 atomic percent Mg dope sample. And we also fitted the decay portion of the photo response curve by which best fitted to the y exponential equation which represent I is equal to I naught I1 exponential minus t by tau d1 plus I2 exponential minus t by t tau 2. And we found that the decay times are t d1 and t2 is found with 30, 17, 22, and 34 to 17, 179, 134, and 206 are the undoped and doped samples. Are the consistency, or we can say that the sample are stable or not stable, we also recorded the switching pattern. Switching patterns means how the samples, the samples are repetitive, or once we get the only photo response and again we, if we recorded, then the pattern is not repeated, then the device, then the samples is not useful for the device application. So for the repetitivity, we also recorded the switching pattern, which was if for undoped sample, the switching not showing the very well, but for the 5 atomic percent dope and 10 atomic percent dope, the switching behavior is very showing the very good response, and the is similar to, and we get the repetitive result. And the photosensitivity we also recorded, which was found to be 22.2066 for the undoped and doped sample. Here in the switching pattern, we seen that the photo current is sharply dropped down to 34, 11, 4, and 30% of the maximum peak value. Here we see that the peak value is this one and dropped to 34%. Here dropped to 11%. Here dropped to 4%. So the 10% is showing the best result for the switching. Now the conclusion: the polycrystalline undoped and MG doped nanocrystalline film are sensitized by sol gel spin coating method. The size of the crystallite is less than 16 nanometer. EDX comes from the presence of MG doping. The doping reduces the size of the grain and rods. The surface roughness decreases for the doped samples. Film are highly transparent in visible and infrared region. Enhancement of 260 MeV in band gap is obtained by the MG doping. Here we can say that if we enhance the band gap, which was the very useful for the optoelectronic devices, 14-fold enhancement in NV emission, and NV emission is obtained in 3.8. That means 5 atomic percent doping sample. The rise and decay time decreases for the dope sample. The best photo response and photo switching is obtained for the 10 atomic percent MG dope sample, which was predicted by EDX is 8.7 atomic percent. Thank you. My special thanks to my supervisor, Professor Anchal Srivastava ma'am and R.K. Shukla sir. And thank you. And this is my university, some scholarship schemes which can be useful for the various institution students which are going to admit in my university. Thank you, Dr. Sudhi.
Thank you, Dr. Nishant sir, for delivering this nice presentations. So I would like to request to all the participants, if you want to ask any questions regarding to these presentations, so welcome for the question for asking to Dr. Nishant. Is there any questions?
Professor Nishant sir, are you listening me?
Yes.
I am audible to you?
Yes, sir.
Sir, I want to repeat your what is PPT presentations, and you have plotted the graph of some straight line. Please show me that PPT.
This one.
You have plotted some graph of straight lines. Yeah, here. Here the slope of the straight lines are changing, but there is no change in the straight lines as I am looking.
No, sir. There are the 4 different samples, and the slopes are changes because there are some points which have for the undoped and 3 planes, 1, 0, 0, 0, 0, 2 planes. We have plotted the data, and their slope are some different slopes. You cannot observe because if we plot in the same scale, then you can measure these things. There are some scale changes. Here we see the 0 to 0.06, here 0 to 0.3. So it may be confused that there are no change in slope. If we plot in same scale, in same graph, then you can see that the proper changes in.
Okay, sir. Okay, okay. Yeah, I am realizing that. Your presentation is very good. Thank you, sir. Thank you.
Thank you.
Thank you, Dr. Nishant, for delivering this very nice presentation. And now I am inviting to Dr. Bindana. Actually, her time was 2:45, but she was going in NAC team, and she is busy. So I am shifting in place of Professor Ashok Kumar Singh, and Professor Ashok Kumar Misra will take on that time. So now I would like to Dr. Bandana, please. Ma'am, I am audible.
Yeah, sir. Am I audible?
Yes,
I just
yes,
want
you
to
are
share
audible,
my
ma'am.
screen.
So now I'm going to tell about brief introduction about Professor Bandana. Professor Bandana did his BDS, MDS in conservative dentistry, and now she is professor. Professor in conservative dentistry, and she has published 53 research papers in various reputed journals, and she is working very administrative and post. So she has work in various field of the medical science. So now I would like to invite Dr. Bandana, please come and share your screen. Yes, ma'am, please.
Am I audible now? Am I audible?
Yes, yes, audible, ma'am.
Hello?
Yes, audible, ma'am. Yes.
Afternoon. Yeah. At the outset, I'm extremely thankful for
Ma'am, your voice is breaking. So please unmute yourself, ma'am. Please unmute yourself.
okay.
Yes,
Now,
yes.
my slide is visible, sir.
No, no. Please share your screen.
Now,
Yes, yes. Visual.
yeah. So the topic of my presentation is explore the concept of ikigai in dental profession. So what is ikigai? Say what is meant by ikigai, why there is a need to apply this ikigai concept in the dentistry, and how to apply it. So first I will see what is ikigai. In Japan country, there is one town called Oshohama. In that town, everyone is very happy and living their life healthy, wealthy, and prosperous. Even at the age of 80 years, they are extremely happy. So the author of the ikigai book contacted that person, and then they say that the reason of their happiness is the ikigai. Ikigai is pronounced is a Japanese concept meaning the reason for living. So when you get out of the bed in the morning, you should know the purpose of your life, why you are there. Everyone has ikigai, and the challenges of every field is discovered it finding the reason for the purpose for your living. The basis of the ikigai is not your life, but also it enhances the lives of others. So ikigai is a very useful in finding the contentment of life and everyday's life. So basically in ikigai, the diagram is given in that book. your passion, mission, vocation, and the profession. So ideally, you should do what you really love. You what the world needs, what you can pay it for, and then what you are good at. So if what you are good is like this, and what you are really love, so that is your passion. What you really love and what the world needs, that is your mission. What the world needs and what you can pay, that is your vocation. And what are you are good and you can pay, that is your profession. So why there is a need to apply this Ikigai concept in the dentistry? So though I did my MDS in dentistry, in conservative dentistry, I also did my master's in psychology. So I think that there is a high need to apply this concept of Ikigai in the dentistry. So modern dentistry involves the number of occupational hazards, including the high level of stress. Prolonged stress can have a harmful effect, including the damage to the interpersonal and professional relationship, diminished health and well-being, burnout and depression.
Recording in progress.
And lower motivation to engage in work and low self-esteem. So various studies prove that the stress is increased tremendously in dental profession, especially after the COVID-19 pandemic. Long-term exposure to the stress can cause physical and physiological problems such as anxiety, depression, cardiovascular disease, digestive problems, anemia, and headache. Individuals face the occupational stress consistency between their professional requirements, their own strength, abilities, or desires. Dentists face considerable stress at the work since from the dental school. Even nowadays, dental students faces a lot of problem because of the saturation. So development of the new and the complex technology methods and the treatment techniques can be an additional source of pressure. Several studies have reported that high level of stress among the dentists, and the many researchers have classified that the dentistry is one of the stressful profession. In a study conducted in the UK by Myers et al., reported that 60% of the dentists reported being nervous, tense, or depressed due to the work stresses. Cooper et al. Also indicated that the cause of the stress among the dentists included sometimes too little work because of the saturation, administrative difficulties, attempts to establish a practice, and dealing with the different types of patients. In a similar study, Humphreys et al. Found that the source of the occupational stress, including treating a high-level volume of the patient, dealing with the nervous patient, and collecting the prolonged experience of the stress among the dentists, can have the detrimental effect on interpersonal as well as the professional relationship, as well as on the physical and mental health. So there are the effects of stress not only on the body, but it also on the mind, it also on the behavior, and it also on the emotions. Body, what we will say that it shows the fatigue, headache, taut muscles, skin irritation, frequent infection, constricted breathing, and in dentistry, like we are having a lot of musculoskeletal diseases. And if in mind, we are always worrying about the future, indecisive, negative atmosphere, foggy thinking, hasty decision, and impaired judgment. And in behavior, we have like sometimes because of the stress, most of the people are faced to the substance abuse, loss of appetite, accident prone, restlessness, loneliness, insomnia, and emotion wise, there is a loss of confidence, apprehension, indifference, depression, irritability, and emotion and insomnia. So, how to apply this Ikigai? Is there any solution? Yes, there is a solution. If you apply the principles of Ikigai in the dental profession, then definitely there is a very, very good future. How to apply? The first is that you should understand what the world needs. Don't leave it to chance what the world needs as you from the as your dental profession. First, find out that. Then, second is that explore what you are good at. You have to find out, explore, or develop the world better. that you love. Happiness will come from the combination of competence, autonomy, belonging, creativity, and the impact. And last but not the least is vocation. If you have rare and valuable skills and you are solving an important problem of the people, money will automatically follow you. So if we don't want one thing, we want the combination of four. We want the mission, we want the vocation, we want the, and that's why these four circles where intersect, that is your ikigai. Sometimes only 2 or 3 circles cannot be like satisfy you, because if you have money, but then if satisfaction or feeling of uselessness is there, sometimes, yeah, in most of the times, suppose your mission is very good, but you are delightful, fullness, but there is no will. So in today's scenario, if you want a happy and a successful life, then everyone should find out, explore their ikigai. And based on that, you have to find out what is your sweet spot, what the word needs means, top 3 core values. Are there any social, environmental, or economical problems you want to help solve? If you are asked to people around you, what would they say you are in an advocate for? Are there the causes in your community or in the world that touch you emotionally? That is your world. Then what you are good at? What are your strengths? Do your SWOT analysis. What are the activities do you experience to flow? What you love? What is your passion? What would you do if money wasn't an option? If you had some spare time, what you spend time doing that? Asked to present to a room full of people on a topic, what would be you want to tell them? What gets you really excited? All these questions help you to find out your passion. And when your passion turn into the profession, then definitely you will get the money. Do you feel that you are doing enough in your current career path? Find out about the profession. Is there any overlap with your career and your other aspects of the ikigai? Do you use and the passion in what you do for a career? Did you study or can you study further to develop your career? So you have to ask these questions yourself so that you can find out your ikigai. There are the 10 rules of ikigai, which is given very nicely, like stay active, don't retire, take it very slowly, don't fill your stomach, give proper attention to your, surround yourself with the good friends, get in shape for the next birthday, smile, reconnect with the nature, give thanks, live in the moment, and follow your ikigai. These are the 10 rules which are given in that book. I designed these same 10 rules in the golden rules in the dental profession so that the future dentist will be happy. So what are that 10 golden rules? Number 1 is that better communication. Better communication with the patients lead to an increase in the degree of satisfaction of the patient. Do some physical activity, number 2 rule. Why? It creates the positive psychological and physiological effects. The happy hormones are released and which are very
Professor Bandana. Dr. Dharmendra.
Yes, Dr. Singh.
I think there is some network issue from the Professor Vandana side.
Yes.
So
we can.
I think she has completed almost topics in their presentations. So kindly call to next speakers.
Okay. So thank you, Dr. Singh, for giving me this opportunity. So now I would like to invite our next, invited speaker, Dr. Shiva Sethi. So Dr. Shiva Sethi is a MBBS and MD, and she has done her postgraduate from Pandit B.D. Sharma, Postgraduate Institute of Medical Sciences, Rohtak. She has done 3 years senior residency from PGI, Postgraduate Institute of Medical, Rohtak. She is presently working as assistant professor in the Department of Community Medicine, Sri Kalyan Government Medical College, Sika, Rajasthan. She has published more than 20 research papers in various journals of national international repute. She has awarded first prize for her best research paper presentations in the various conferences. She is awardee of Young Researcher Award 2021 for contributing for her, contribution in COVID-19 research. So she is a author of various books also. She has written 3 books on community medicine, CBME based practical practices, and Viva in community medicine. And she is recently she has been awarded as a Powerful Women of Haryana Award 2022 by the Honorable ex-Chief Minister of Haryana, Sri Bhupen Singh Hooda ji. So Dr. Shiva is a renowned and very well-known academician and researcher in the field of public health. So thank you so much, Dr. Shiva, for giving your valuable time for this conference. So you are most welcome.
Dr. Dharmendra, for giving such a beautiful introduction. Shall I start sharing my screen?
Yes, sure.
Is the screen visible?
Yes.
Okay. So in today's conference, I'll be presenting one of my research study which is planned and conducted in Uttar Pradesh itself. It is prevalence of urinary tract infections in febrile children admitted in Tertiary Care Institute of Uttar Pradesh. As we all know, UTI is a very common cause of fever and is one of the most common bacterial infections seen in children. It is most common reason that under 5 children they visit emergency or OPDs. The reported rate of recurrent UTI is around 12 to 30%, with the risk greater in infants who are less than 6 months age, with severe vesicular reflux and abnormal nuclear renal scans at the time of first infection. The present study aims to explain the prevalence of UTI in febrile children who have been admitted in Tertiary Care Institute of Lucknow, Uttar Pradesh. This cross-sectional study was conducted in Department of Pediatrics, MIMSR Medical College, Latur. Children in age group of 2 months to 6 years who were having fever and who were admitted in pediatric ward of the hospital were included in this study. Children with congenital kidney anomaly and children who were not having fever and those who were below and above the required age group and those whose parents didn't give any consent to participate, they were excluded. Sample size was calculated on the basis of pilot study which was done in Department of Pediatrics itself. The prevalence of UTI in the pilot study came out to be 8%, and on the basis of prevalence 8%, we have calculated sample size which came out to be 176. So we have taken 370 participants in the final study. A pre-designed semi-structured questionnaire was used to collect the information from the participants, and the information included was demographic data, clinical presentation, clinical examination findings.
Lab investigations like CBC, urine routine, urine microscopy, urine culture, and any other relevant investigation which helped in making the diagnosis like ultrasound, serum electrolyte, micturating cysto urethrogram, etc. were also done. The diagnosis of UTI was confirmed using urine culture, and this collected information was entered in MS Excel and then analyzed using SPSS version 17. Results of the study. In our study, we found that the prevalence of UTI in children less than from 2 months to 6 years of age were 11.9%. The diagnosis of UTI was confirmed by urine culture, and it was observed that urine culture sample of 45 children out of 378 were positive for UTI. In the second table, we can see the relationship of various demographic factors associated with the UTI, and we can see over here that the majority of participants who were having UTI were from age of 25 to 36 years and 61 to 72 years. Then again, we are seeing here that female children were having more UTI in comparison to male children. Pain in abdomen associated with UTI was more seen, that was common. Similarly, burning micturition was very common and was seen in 80% of those who were having UTI. Urine frequency was increased in 73% of children who were having UTI. And similarly, urine output was reduced in 6% of the children. And we found that age, sex, various symptoms excluding urine output, all were statistically significant with UTI. Means it depends upon age, it depends upon the sex, and the various symptoms basically are prominent in UTI. Then we have done the urine microscopy also of the children, and we found that those who were having UTI, out of them, 68% did not show any pus cells in the urine microscopy. And 12.7% of children were showing plenty of pus cells in the urine microscopic sample, in spite of the fact that they were having UTI. This is the table which is showing us the presence of other associated complications in children presenting with UTI and OPD. Two individuals who presented with UTI, they were also having hydronephrosis. One of them was having renal calculi, and two were found to have deranged renal function tests. So in present study, out of 45 cases, complications were observed in only 5 cases. Out of them, hydronephrosis, deranged kidney function were common and seen in 2 cases, while renal calculi was seen only in 1. So, coming to the conclusion of the study, we have seen that the prevalence of UTI was common among children 2 to 6 months, and it was around 11.9%. And this prevalence was less than 2 years children. Female children were having higher prevalence of UTI as compared to male children. Thank you.
So, thank you, Dr. Shiva, for a very nice presentation. And now I would like to invite, participants. If you want to ask any query regarding this presentation, please ask. The floor is open for queries, suggestions.
And I would like to thank you, Dr. Sushil and Dr. Dharmender, for giving this brief introduction and giving me an opportunity to present this invited talk in your conference. Thank you.
Thank you. Thank you, Dr. Shiva, for your presentation. So, Dr. Singh, any other projector? Please unmute yourself. Please unmute.
Yes. Actually, Dr. Shiva has finished within a time, and her time was 12:40 to 1 p.m. So our next session will start at 1 p.m. है ना?
Okay, no problem.
So I think records already present. Have you records or not? A49 to A54.
Mhm.
Dr. Dharmendra sir.
No, I don't have actually.
Actually, we have sent in our NCIR group, है ना? So
Okay.
there is a mention, है ना? A49 to
1
A54.
p.m. Yeah, 1 p.m. Okay. A49 to
A49, A54 in this session.
Okay. So can we start with this or we can wait?
Yeah. You may start, sir.
But I think presenters are not there. No?
Yes.
So
So
don't worry.
we can wait 5 minutes. I think there are 4. We can start at.
Yeah, 1 p.m. So thank you, thank you, Dr. Shiba, for your wonderful talk. So thank you so much.